It's time for health tips. Now here's your host, Dr. Alma Jenkins.
Good evening. Thank you so much for watching. I'm Dr. Alma Jenkins, and this is Health Tips. You know, it's such a pleasure to bring this show to you on Saturday nights. I appreciate your watching. I was just in Golden Corral this evening, as a matter of fact, and someone was telling me how much she enjoyed the show. Well, we enjoyed doing the show, and we hope you'll keep watching because we want to expand the show and do some different things with it in the future. So thank you so much for your viewership, I should say. We really appreciate it. So what are we going to talk about tonight? Well, first, before I tell you, let me just say that Health Tips is willing to come to your home, I'm sorry, not your home, but your organization, your church, and talk about a health topic, whatever you would like us to speak about from the medical standpoint. Now, naturally, speaking about gastroenterology is a very natural thing for me, but if you'd like us to talk about, hypertension, diabetes, whatever works for you, we can certainly do that. So just give us a notice, give us at least 3 or 4 weeks lead time, and we'd love to come out. And also, if you've missed some of the show and you would like to see the show, you may tune in to dralmajenkins.com, and there's a link there to the YouTube channel, and you may watch us on YouTube. A lot of people, I think, are enjoying doing that because sometimes you're busy and you're not able to tune in on a Saturday night. Okay? So we hope that you'll enjoy that. We'd love to get some feedback from you about our show and any suggestions that you have. If you'd like to send in a healthy recipe, then do that. We may pick your recipe and we may ask you to come on the show and make it for us. So do send in, if you have something that you're really good at or, you really love, just send it to us. We'd love to make that dish and see how it tastes. All right? So tonight we're going to talk. Now, we try and do recipes and cooking, but occasionally we also like to do other things. And I should say more often than occasionally. We often are talking or otherwise giving information to you other than in the kitchen, but we love being in the kitchen. Tonight I want to tell you a little bit about hepatitis C. And the reason I want to is because things have changed a little bit with hepatitis C. At one time, the treatment was long, 24 to 48 weeks of treatment for hepatitis C, but now it's down to 12 weeks depending on what type of hepatitis C that you have. So pull up your chair and let's talk a little bit about hepatitis C. First of all, what is hepatitis? So now some of you may have hepatitis or you may know someone with hepatitis. The word itself, and you may recognize these last letters, itis. When you see the word itis, you mean inflammation or irritation, such as gastritis, irritation of the stomach, arthritis, irritation of the joints. Hepa, meaning liver, titus, meaning inflammation, okay? And you know the rest of that. So the liver is inflamed. So when you see the word hepatitis, it doesn't tell you what type of inflammation or if there is actually infection, because when something gets infected, it is inflamed, okay? So we're going to talk about a specific type of inflammation. This one happens to be an infection. So remember, if you want to think about inflammation, think about if you take sandpaper, rub it across your arm, and the arm gets swollen and red or otherwise irritated looking where you rub the sandpaper. That would be an itis of your hand. All right. Now, if that turns around and gets infected, meaning maybe some pus comes from it or it really starts looking bad, then it's an infection. So not all inflammation or irritation is infection, but all infection has some inflammation in it. I think that's true enough to say. All right. So if we talk about hepatitis, there are different kinds. The most common kinds that we see in terms of infection of the liver would be viral hepatitis. Now, you can have other kinds of hepatitis. You can have hepatitis from ingesting something that makes your liver sick. So let's say somebody gets toxic with Tylenol. You can get an inflammation of the liver and a hepatitis related to that. But we're going to be talking about a viral hepatitis. And there are different kinds. There's hepatitis A, B, and C. Well, there are also D and E, but we're not going to concern ourselves with those. Those aren't as common, and I don't think you're going to need to be worrying about that right away. Let's talk about these, and then at some point in the show later, I may say something about D and E one day on a show, but just keep in mind that the more common viral hepatitis infections are A, B, and C. Now, D is not that common in this country, but there is such a thing, and there is such a thing as hepatitis E as well. Let's talk about A, B, and C for now. Hepatitis A. Well, you can see that in children at daycare, in elderly people in nursing homes, and it is spread primarily through food and contamination. You know, somebody uses the bathroom and doesn't wash their hands, or somebody, you know, or it's in food that someone who didn't wash their hands and goes and fixes food and contaminates it with that virus. So that virus is not intimately transmitted, okay? So it's primarily non-intimate contact. Whereas B and C, close contact. Okay, so close contact for B and C. We see B oftentimes with, you can get it from needle sticks, you can get it from sex, you know, those kinds of things. So close contact, same for C, close contact. Both of these do have some treatment for them, but I want to focus tonight on hepatitis C. Hepatitis C. And the reason I want to focus on it is because the treatment has changed. Now, hepatitis C also has various types of hepatitis C. So you may have been told, oh gee, you have hepatitis C. Well, hepatitis C has various genotypes. Genotypes. Okay, so there are various genotypes of hepatitis C. And so I want you to be aware of that. So I'm going to talk to you tonight primarily about genotype 1. Genotype 1, because that is the most common genotype in this country, that most people in this country have, are genotype 1. All righty, thank you. So I'm going to erase the board here for a minute. So let's say some doctor, one of your doctors tells you that you have hepatitis C, okay? And I pick hepatitis C because now if you have, and it has different genotypes, so let's talk about that. So you could be genotype 1, genotype 2, genotype 3. Let's just go with the simplest first. All right, the most common genotype in this country is genotype 1, and that's where we're going to focus tonight. And the treatment for that is only 12 weeks. Used to be 24 weeks, 48 weeks. Now it's only 12 weeks. So that is a very good thing. And the cure rate is high. 90% cure rate now for hepatitis C. So those of you who have it now, this is a great time to get treated for it, because now the treatment is much simpler. You're just taking pills and it's only 12 weeks. So ask your doctor about that, okay, if you've not been treated for it. And if you have hepatitis C, you should also have had your vaccination for hepatitis A, your hepatitis A vaccine, and B, okay, so that you make antibodies to those. All right, unless you already have the disease. Okay, so let's talk about the fact that you can get treated for 12 weeks and be cured, essentially, in about 90% of the cases. And why do you want to get treated for hepatitis C? You might say, well, I've been with it this long. Well, one reason you want to is because let's say that you continue to have hepatitis C for many, many years. You could eventually develop cirrhosis, or eventually develop cancer. Now that doesn't happen, this doesn't happen with most people who have hepatitis C, but it is possible. And most of the time, liver cancer comes in a liver that is already diseased most of the time. And one of the common diseases through which that can occur are the hepatitis class of diseases, okay? So what would we do? What is cirrhosis? Because many of you had that question. You weren't real sure what cirrhosis really was. Well, let's look at that. Many of you have seen cow livers. You know, if you came along in the day when they were killing hogs, you know what a liver looks like. But many of you know nothing about that. So let me just remind you of the livers look very similar in animals and people. The liver is kind of a dome-shaped organ, okay? And it has kind of a tapered, one end is kind of tapered looking. And the liver is a very vascular organ, meaning that there are a lot of blood vessels within the liver, okay? So normally it's this bloody organ in our bodies that many of you are familiar with. Now the liver has a lot of functions, but when it gets cirrhotic, that means that the liver gets scarred up. You know, there's a lot of scars on it. And as it scars up, it shrinks. So instead of it looking like that, nice and smooth, a liver with cirrhosis may look like this. Looks like I drew it with a nervous hand. Look at that liver. Doesn't that look different than this nice smooth liver that I drew for you just now? Look at the difference in that. So this liver is all scarred up and lumpy. That is a person that probably has what we call end-stage liver disease. Okay? That person has real problems because the liver does a number of things that we really need to have it do. And what are some of the things, and let me just get this. What are some of the things that the liver does? Well, for one thing, the liver makes vitamin K. Okay? And that helps us to clot. Okay? So when we don't have a good liver or it's shrunken up and cirrhotic, it might you may start to bleed easier. So it may not clot as well. All right? That's one thing. Number two, your albumin, which is a protein that the liver helps to make, that may go down, and that will affect you in many ways, cause you to collect more fluid in your belly and in your legs. Many of you know people that have cirrhosis, and they may have a big belly, come in to the hospital to get their bellies tapped so the fluid comes out, okay? And if we draw your blood, we find that the blood may be very thin, meaning that the blood will show that you clot easily. So these are people with end-stage liver disease. So you don't want to develop into that. So you want to get rid of that hepatitis C virus, because those people who are getting treated because they're still carrying the virus. All right? So also, if you have hepatitis C, not only will your doctor, in order for you to get treated, your doctor is going to not only confirm that that's what you have, so they're going to draw blood on you to check to be sure that you do have hepatitis C. And then, so that's one, we are going to confirm it. Second, we're going to find out how heavy is your load. So we're going to do a viral count. Okay? Thirdly, we're going to check your liver tests. We call them liver enzymes. We're going to check those to see just how things are. Fourthly, we're going to check your clotting. We're just going to check that so we know. And that's a PT and an INR. Those of you on Coumadin, which is a blood thinner, you're very familiar with PT and INR. Okay? So you know what I'm talking about. But we're going to check all of that if you're thinking of treating you. We're also going to check something called FibroSure. That's a test that we do in lieu of biopsying your liver. We can do that as well. But this gives us an idea as to whether you're starting to form a lot of scarring in your liver or not. It's kind of a way of looking at the liver without biopsying it. Okay? So we would do a FibroSure test, and that's a blood test. Okay? So these are the kinds of things we would want to have drawn on your blood if you were thinking about getting treated for the hepatitis C virus, and particularly if you are genotype 1. Okay? So that makes it really good. So can you think you've got that now? We're going to give you a test on it. No. So what happens if we get rid of the virus? Well, your chances of developing end-stage liver disease would go down dramatically because you've removed the source of the inflammation and infection. And so I encourage those of you out there right now who do have hepatitis C, talk to your doctor, see if you're eligible for the treatment. So you say, well, who's not eligible? Well, the people that are not eligible would be, 1, those who may have any allergies to the meds. 2, if you're in a severe depression. So let me jot that so you can remember it. Any allergies that we know of. Most people don't really know if they're allergic to it yet. Number 2, if you have an untreated depression, let's say you have severe depression, that will have to be brought under control first before you're treated. 3, are you still drinking if you have a drinking problem? Or 4, if you're non-compliant. Okay, if you're the kind of patient who doesn't do what they're told, who doesn't take their medicine, we wouldn't want to enroll you in that program because you really need to follow your medical instructions to the letter. And if you do, you'll come out with the results that you expect most of the time. Okay, so those are kind of the things we look out for if we're trying to treat you for hepatitis C. But I wanted to just let you know now that the treatment is so much simpler. And I hope that this helps you, especially those of you who do have hepatitis C. And if you have a friend that you don't think watched the show tonight, let them know that there is actually treatment out there now for hepatitis C, and it's 90+% effective. And that's the best we've ever had. All right? So let's see. We have a few more minutes, and you know what I want to do with that, right? I want to exercise for those minutes that we have left on the show. So what I'd like you to do is get your cans or get your dumbbells. You know, when we're in the kitchen, we do cans. But since I'm not in the kitchen tonight, and I was speaking to my producer, and he said, oh, you're not in the kitchen, so use your dumbbells. So that's what we're going to do tonight. We're going to use our dumbbells here, and we're going to do some exercise. And I hope you're doing these through the week when we're not watching you, but that you're all by yourself at home. I hope that you're going to be exercising and getting your body in the very best shape that you can. Because right now, this is what we have to work with. You know, many people, especially church people, you know, we're looking forward to, you know, the future and how things are going to be so much better. Well, that's great. But right now, we're in these bodies, and we need to try and treat these bodies the best that we possibly can. Okay? So 1, 2, 3, and 1. And 2, 3, and 4, 5, and 6, 7, and 8, 9, and 10, 11, and 12. Come on, do these last 5 minutes with me. And 14, 15, and 16, 17, and 18, and 19, and 22, 3, 4. Now, you know, these are 3-pound weights, and I'm starting to feel it in these arms. I want you to stop when you're exercising like this and give yourself a deep breath. Let it out. Deep breath in. Let it out. One more deep breath in. And let it out. Now next week, we're going to talk about ulcer disease. That's a very common problem, and I want to make sure that you understand some things about ulcer disease so that when you go to see your doctor, you can ask certain questions and come to understand a bit better what's going on with you, perhaps, or maybe even help your doctor to be able to determine what's going on with you by your giving him all or her all of your symptoms. Okay? So we're going to talk about ulcer disease next show. Go ahead and do a little research so you can follow me along. All right? Now, let's do some more exercise. We've got about 4 more minutes. So let's just stretch a little bit. 1, 2, 3, and 1. And 2, 3, and 4, 5, and 6, 7, and 8, 9, and 10, 11, 12, 13, let's do 15, 14, and 15, 2, 3, 4. Wow, great. Wonderful. Now, I know there are a lot of you that say, you know, I can use my arms, but, you know, maybe you have limited use of your arms. Maybe there's some problem with them, but you do have pretty good use of your legs. Now, I realize that most of the time it's just the opposite. You may not have great use of your legs, but you do have good use of your arms. But just in case it's the other way, let me show you some things you can do with your legs, and I hope you can zoom in on that. You can hold your legs up like so. All right? And just hold them there to the count of 20 and then open them. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now open your legs and hold it there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Close slowly and bring it down. Now bring it back up, bring it down, and up and down, and up and down. Let me tell you, you're going to feel that in your thighs because it's kind of like almost like resistance exercise. Okay, and just lift and put down, and lift, put down, and lift, put down, and lift, put down. Okay, you try that. You will begin to feel it, and you're not wasting your time at all because you're going to feel that in those thighs. All right, let's count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10, and down to the floor. Deep breath. And out. Deep breath in again. And out. Ladies and gentlemen, this is Dr. Alma Jenkins. Thank you so much for watching. We look forward to seeing you again next week here at WHFL. Good night.